Tourettes Syndrome. What it is that makes you tick. Imagine sitting in class taking a midterm. Your nerves are on end and you're exhausted from staying up all night studying. Suddenly, the person sitting behind you starts to kick your desk. You think to yourself, alright, he is probably nervous. Just ignore it and he will stop. But it doesn't stop there. And he screams out a string of cuss words. At this point you think, this guy is just trying to be funny. But finally, his shaking and yelling gets so bad that he has to leave the room without completing his test. The phenomenon that you have just witnessed was not some single-minded frat boy trying to get a laugh from the pretty girl in front of him. This boy suffers from a very serious disease known as Tourettes Syndrome. Coming from a small town, I have never actually seen this syndrome in action. However, I have seen movies and documentaries about the illness. Being thrown into college, I'm now getting to experience different people who come from different places and may even suffer from different sicknesses. In the next few minutes, I will first explain what Tourette's Syndrome is, who it is affecting, and lastly, what is being done to defeat the disease. But let's first begin by defining and investigating what Tourette's Syndrome is. According to the National Institute of Neurological Disorders, Tourette's Syndrome, or TS, is a neurological disorder characterized by repetitive involuntary movements and vocalizations called tics. Tics are classified as either simple or complex. Simple motor tics are sudden, brief, repetitive movements that involve a limited number of muscle groups. Complex motor tics might include facial grimacing combined with a head twist or a shoulder shrug. Perhaps the most dramatic and disabling tics include motor movements that result in self-harm, such as punching oneself in the face, or vocal tics, including coprolalia, uttering swear words. There are many signs and symptoms that indicate Tourette's Syndrome. The first tics usually begin in smaller areas of the body, such as the mouth or eyes. However, if you have Tourette's Syndrome, these small tics don't go away, and as time goes by, they actually become worse, moving into other parts of your body. In most people, emotional stress or different forms of anxiety make their tics worse. For example, a student trying to focus on a test may have a hard time keeping their tics under control. Next, let's look at who exactly Tourette's is affecting in the United States. Tourette's Syndrome normally becomes apparent in the childhood stages of life. According to WebMD, Tourette's Syndrome afflicts 3 out of every 1,000 children between ages 6 and 17. 3 children out of 1,000 may not seem like very many, but the children who are affected by TS develop many different psychosocial problems. They have feelings of not belonging, or they become embarrassed to go into public. Even though symptoms do seem to get better as children transition into adulthood, when adults are placed in stressful situations, their tics sometimes seem to resurface. Lastly, let's examine what treatments there are to defeat Tourette's Syndrome, both without drugs and through medicine. To treat Tourette's Syndrome without medication, patients must first get involved. When people suffering from TS participate in activities, their tics become milder or less frequent. Once patients become comfortable in a situation, they can better control their urge to tic. Tics are also being loosely controlled through drug therapy. As stated by Dr. Cheston Berlin, there are medications that will reduce tics, but none are a cure. The drug Haldol is effective for 60 to 90% of patients. The medication is started at a low dose and must be slowly increased until the tics are reduced or until side effects are encountered, and usually the side effects are reversible. As you see, sometimes the benefits of the drug are not necessarily worth the side effects of the medicine. All in all, the decision of what kind of treatment to partake in is ultimately up to the patient and their family. In closing, today I explained the basic symptoms of Tourette's Syndrome by first defining the disease. Secondly, explaining who in the United States is being affected by this hindering disease. And lastly, what is being done to beat this disease. So the next time that you're sitting in class and someone seems to have a nervous tic, don't just assume he is trying to be a jerk or entertain the classroom. It could be something more. They could be suffering from a very serious disease known as Tourette's Syndrome. The red button.